Hi everyone, Dr. Rob Kiltz. How you doing? Happy New Year. Let's see. I guess this is the first of 2020. We're still on Sunday nights, 8 p.m. We may be shifting it up, but that's all to come. And I'm clean shaven today. I tried it. It was a challenge for me. But welcome. Facebook, Instagram. Hello to all. And hopefully you guys are going to be able to hear me, and we're going to continue answering questions. Let's see, Amber, Melissa, Kayla, hello, and I think we're going live here on our Instagram. It's maybe a little slow in getting started there. Ardell, how you doing? Yased, Diane, hey, Amber. PCOS, is it possible to avoid the PIL shots after FET by having ovulation induction and then using endometrium suppositories? Absolutely. So we're doing a lot more natural cycles for frozen transfers, and also going to be using a lot more letrozole trigger shots. So if you have PCOS, absolutely doing more natural. And we're going to really work on more natural cycles for frozen transfers if you have regular cycles. Hello, Kristen. How you doing? Thanks for joining us on Instagram. So more and more to use less progesterone and oil, more natural cycles. That's what we're going to be moving towards in the 2020 year. Continuing affordability, access, quality. We're working to get our Buffalo going pretty soon. Already, Dr. Chang's doing awesome. Dr. D'Souza, Chris Ziegler, our great team there. Don't forget Rebecca and Susan from Albany. A shout out for our practitioners there. All of our team members, by the way. Let's see here. Jesse Guerin for another egg retrieval. Dr. Dickoff wants me to up the gonal to 350. One of the SBCs doesn't think I should. Keep it 150. Your thoughts? Last egg retrieval, we got 22 eggs, 11 are mature, got 4 embryos, all transfers failed. This is where I'd probably keep it to the lower, add the human growth hormone. Don't forget Kiltz's keto. Oh, wait a minute. Miss Maria Emmerich, new carnivore cookbook's out. Really excited about it. And shout out to Maria, by the way. And Simply Keto by Susan Ryan. Check it out. It's got some really great recipes. Just another, and Keto Karma has some really great stuff. So take a look, see what you think. Talk to the team members. But if you're making a lot of eggs, more of a gonadotropin doesn't help, but maybe add a little bit of Menopur, trigger with some HCG, and add a little human growth hormone. We're a little slow tonight on our Instagram. We got to round up the gang out there. Natalia Alvarado, how you doing? What can be possibilities cause of recurrent miscarriage? All right, I just downloaded my complete list of phytochemicals, which is a crazy one. And if you haven't checked out our, there's our the keto stuff, or our family building guide. If you go to drkiltz.com or at cmyfertility.com, you can download our family building guide. It talks a lot about recurrent pregnancy loss, inflammation. What's the cause? It's all inflammation. It's caused by what you eat and how you take care of your body. It's really a crazy, amazing concepts that we're finding how reducing inflammation in the sperm source, the egg source, and the environment for the embryo. Don't forget, silent endometriosis. Endometriosis is a common cause of inflammation, which I believe is all based on a high plant-based diet or eating 3 to 6 meals a day, which is crazy, or low-fat diets. Up the fat, reduce inflammation, add intralipids, but it's all regarding inflammation, by the way, the same thing. And so that's why we want to work on our immune protocol. And Nephew Will, congratulations. Miss Ella just born. Shout out to Noel, awesome, and Nolan, the new big brother, has a new little sister. But he put together my new immune protocol list. It's going to be on the website, downloadable for everyone. Hopefully everyone's going to be checking out. Hang on there. Let me make sure we got our working right here. All right. Let's see. Hey, Brittany Harris, how you doing? Melissa, hello. Nikki, Robin, hello to everyone. Angela, what is your opinion on the safety of early transvaginal ultrasound? That's one we're probably going to be looking at and talking more and more and more about. Too much of anything probably isn't good. Spending too much time looking isn't good. We either want a quick abdominal pelvic ultrasound to confirm is there a gestation in the uterus. If there is, let's not spend too much time there. I don't know, but energy sources may be a factor in all of this. So we may be disrupting and inducing inflammation in it, or is it simply the sound waves that are affecting all of that? I don't know the answer to that. All right, we got a short list on Instagram. Welcome, ladies and gents. Callie Hill, Aji760, Kristen 1978, and Joshua Sweet. Hello, hello, hello. And again, let's get some more Instagram. But we're working to put us onto YouTube also, by the way, and share more of this, by the way. But I think we should talk about less ultrasound, especially vaginals. But we got to be more gentle and keep it only to a few minutes at most. M babies, faith, love, joy, peace, glory, mercy, and victory. Dave, a pleasure. God bless. And we all have to keep the faith and have the positive belief of life that what's possible, everything. And remember, that great creator we call God, nature, whatever you choose, make it as positive as possible every single day, by the way. Hey, Cheryl DC. How's the boy doing? A shout out to all. Hello to Florida, California. Good friend, Dr. Paul Magarelli, visiting this week from Colorado Springs. We're working on CNY Fertility, Colorado. Very excited. And we're going to be working this year. I'm going to get Buffalo done soon, by the way. And then Atlanta and Colorado, we're working on all of those. But a shout out to our teams in Albany, Syracuse, Rochester, and Buffalo, Montreal, Atlanta, all rocking, doing a nice job. Denise Knight from Kentucky, hello, hello. Natalie, how are you doing? Let's see. First consultation in February. We'll look forward to talking. Now listen, to everyone, download the Family Building Guide. I know it's backwards. And Dr. Kiltz's Keto. Don't forget Maria Emmerich, and give a shout out again to Susan Ryan, the Keto Karma. Look it's all about eating less frequently, adding more fat, reducing the variety. I think it's really important, by the way, and it gets rid of the inflammation. But the more you read from our magazines, watch our lives, share them with your friends and family and others, it really is a home run, I think, in so many ways. How long after miscarriage? Marinus P. How long after? Let's see. After miscarriage, how long can I try to do it again? Transfer with ED. It appears a miscarriage week of December 30th. So sorry for the miscarriage, by the way. But anywhere between 4 and 8 weeks is usually the time frame, the next regular cycle. If you don't get regular cycles, we should do an ultrasound and some blood work, see what's going on, and see where you're at. But let's try to identify, was there inflammation? Should we be thinking about the immune protocol? Don't forget, talk about and ask the nurses and the team about the antihistamine protocol, which is Benadryl, Claritin, and Pepcid. Reduces inflammation. Don't forget the 30 to 60 days, or Lupron, and the letrozole reduce inflammation and endometriosis. Remember, if you're not doing a laparoscopy for this, then you should consider the 30 to 60 days. All those joining us, welcome. Again, We're going to be continuing with the IVF giveaways, the fertile financing. We're working on some ways to make it more efficient and easier for everyone in the process, by the way. I just got to adjust this so it makes it easier to read the questions. Let's see. And we're going to keep on. Miss Tina 0319, thanks for joining us. I'm going to keep doing this. You can get them live, but they're on reruns. But again, we're all working to share the ideas together of what we can do to help be supportive, positive as possible in the very challenging, very emotionally stressful process of dealing with infertility, repetitive losses, but they're all about the same, by the way. Hey, Tamara from Mississippi. Magdalena, how you doing? Taylor T. HCG washes. You know, there's some controversy over the PRP wash, HCG wash, and Neupogen washes, but the whole idea is that somehow that HCG is a factor that helps with enhancing the progesterone receptors, enhancing the receptivity of the uterus. We think that HCG wash may help with that, but it's not a slam dunk. We can't answer exactly why. But they're simple, they're not very costly. We're really working to keep the cost down, the affordability up in the whole process, by the way. Let's see, Hall for the love, hello, hello, hello. And we're always sending lots of love out there to everyone. And I'm grateful to everyone for sharing. Dr. Corley, Dr. Luther, you're in Syracuse. Our whole team of global, our fertile financing team, we're really working that we can better help give everyone access, recognizing sometimes it's a challenge, it takes a little time. I did take 10 days off, but I'm here to keep going. I'm getting a lot of questions, texting, emails, calls. Share it out there if you know the answer, by the way. So I'm really grateful to my global team for putting all the information and keep on sharing with everyone. Karen Jacobs, I look forward to seeing you. DNC on 12/23, HCG all the way back down to 0. Start another cycle. We can get you on another cycle once your period starts if you have regular cycles. In the meantime, call in and say, hey, I want to get ready for my next cycle, for a frozen cycle, a fresh cycle. Remember, we support whether you're doing intercourse, IUI, or IVF, whatever the process you're doing, we're here to support it all, by the way. All right. Is it necessary to take the Neupogen? Says it's for cancer patients, but I have never had any form of cancer. All right. There are a lot of drugs that we use that are off-label. Neupogen was found to enhance implantation in some people that had failed implantation, multiple failed IVF cycles, repetitive losses. It's not necessary to take or do any of these things, but we're putting a global approach of possibilities that might help you. Just like we talk about keto diet, faith, we talk about reducing inflammation, slow down, cool the body down, don't heat it up, by the way. All right, we got FB Hitty, how you doing? Sandy Lace, hello, and Laura Tiffany. And I apologize if I'm pronouncing anyone's names wrong, not my intention, all right? Not covered by insurance, by the way. And again, we're offering things that even though they're not covered by insurance, still might be helpful. And the Neupogen, sometimes you can find other sources, by the way. So don't give up on it. Melanie, hello, Parker from Buffalo. Alyssa, do I have to do IVF for, IVF for peaks? We did one cycle with you. It was canceled because I ovulated too early, one failed IVF. So these ovulation early may need extra Cetrotide, Lupron, or make sure you're doing earlier monitoring in the whole process, by the way. But you don't have to do it again, but I would certainly be open to the possibility that we got to watch it a little more carefully, maybe consider a long Lupron protocol where you start Lupron a few days to a week prior to your period. We also do a Lupron flare, micro flare. That might be another way to do it. Happy New Year, Ronia. Let's get people going, and I'm sorry for the fails, the hardship, the high cost. And don't forget, check with your employer whether or not they're covering IVF in New York. That said, is you gotta push your employer to cover it, even if they're not mandated. We're really working on sources for lower cost meds, continuing to finance everyone in the process. All right. Hey, Sandy, how you doing? Good. Again, a pleasure to everyone for sharing. Facebook, Instagram, YouTube. But again, personally share the stories, the ideas. Don't forget, go to our CNY Fertility website, download the Family Building Guide, and download the Keto Magazine, and get our list for our immune protocols 1 through 4. Really helpful in the process. Let's see, Mulakat from Florida, Sarah, hello. And Miss Sophia, Happy New Year, a great year. And Miss Sarah, thank you to all of our team members for all the work you're doing and all the support from our clients also. All right, you said 6th week of pregnancy, we have no words. Again, blessing, and gratitude to everyone. We need to continue to communicate. We're here to help people throughout the whole process, whatever they're going through, by the way. Hey, Nikki Q, how you doing? Rosa, Denise, 2 rounds IVF and 2 failed transfers. Let's see, let's get some good questions. Low progesterone. Again, natural cycle with the trigger, letrozole trigger. Don't forget the oral prometrium, the intravaginal suppositories can be really helpful in all of that. Let's see. Hey, Kate, how you doing? Kate Lodge, opinion on FET while breastfeeding. All right, a controversial one for sure. Plenty of women get pregnant breastfeeding. The concern is that you're using drugs to help you get pregnant. They could affect the baby. My bet is they're short-lived. They're likely low risk, but not no risk. There's a little bit higher risk of miscarrying because of luteal phase problems and all of this. So generally we recommend not breastfeeding, but if you are, we can still do it. I think the risk is small enough. Nicole, hi. Ovulation to occur in PCOS. Good follicles, but doesn't seem like I'm releasing eggs even with trigger shot. That'd be unusual to not get a release of the eggs with the trigger shot. Make sure you're checking the progesterone level a week after the trigger shot. If it's not 10,000, you might add a little bit more, even 15,000 of HCG, or a dual trigger of 4 milligrams of Lupron plus the HCG, 10,000 units. Add the letrozole, 5 to 10 milligrams. You might even do a combination of 5 of letrozole, 50 of Clomid, and maybe even a little bit of low-dose injectables for a few days. But it would be very unlikely not to get that release of the eggs. Check a progesterone level, add an IUI in the process. But the progesterone levels will really help on that. Adenomyosis, endometriosis. Please talk on adenomyosis, infertility. Can it cause infertility, and can IVF work for someone with adenomyosis? All right, this is where 2 months of Lupron or Alyssa plus letrozole, Kiltz's keto, which is bacon, eggs, butter, beef, and ice cream. Now remember, you don't have to have pork. You can have beef bacon. You can do fish, high fat. Remember, the carbs contain the toxins, the phytochemicals that I believe cause adeno and endo. The fiber is bad and probiotics are bad for us. But I believe that a 2-month supply of the Lupron or Alyssa plus letrozole helps reduce inflammation. Then go right into a low estrogen protocol with some letrozole, and then do a trigger shot or add the progesterone once your lining is 7 or greater. That will really help. And don't forget, a little bit more of an immune protocol, LDN, CBD, even some Somaderm or the human growth hormone to add to that, which I think can help a lot. And don't forget CBD oil, CNY, CBD, and right on our shop site, you can also get the Somaderm, which is the topical homeopathic human growth hormone that I think is worth looking at and trying in a prime. Don't forget acupuncture, massage, meditation, prayer, and visualize. Put the vision board up of you and babies, your partner and babies, the things that you desire in life. Imagine you have them, and then they will be or better. That's the most amazing trick of the universe. All right. Hey, Tiffany Lewis. Is keto still the way to go even though I have endo? Keto, keto, keto. The red meat messes me up. Look towards fatty fish. Add fat to your chicken. Again, it's butter, cream, sauces. That's really the key. Some people they have some sensitivities to the meat based on its grain fed or somehow the toxicities of the grasses that animal is eating. That's really important. Look towards grass-fed organic. That might be helpful, but look at fish, look at chicken, look at pork, look at lamb, goat, lots of different ways, duck, lots of different ways, but you have to get the fat. The fat is the super fuel of our bodies, and being fat is actually fitter than people know. It's the high carb plant-based diet that we eat 3 to 6 meals a day is not good, but Kiltz is keto, carnivore. Again, whether it's steak or fatty fish, that's really the key that we're looking at. It's get rid of. And don't forget, Miss Maria, this book, you should be able to get it through our website and also Amazon. And don't forget to check out The Fertile Secret and see what you think. Hey, Ken Carter, God bless you guys. We're here to help and not give up, not give up. Remember, this is hard. It's way hard. I don't know how anyone gets on this crazy journey, but here we are alive on this journey. We have to grab onto the faith and grab onto that magic ring. Dr. Lutheringer, it's just that ring, the golden ring, the brass ring. Hold tight and keep moving, right? That's it. Hey, Raniera Costa, how are you? Never stop thanking all of us. And God is great for all of us. We have to imagine that no matter what God puts us into, he, she, it, the universe knows what's right. And the more we leap forward, remember, just lean forward, and you're either going to fall flat on your face and you're going to dust yourself off and get up, or you're going to put that foot in front of you and keep going. Boston, hello. MK Terry, how soon can we get you a transfer? We can get you transferred. We see a lot of people that come from Boston, from all over the country and the world. We will take those embryos and we'll help make it affordable. Would include what you put in the mind and the mouth, keto, reproductive immunology, acupuncture, all these things. But we should be able to get you going pretty quickly. Waiting 2 to 3 months between transfers. No need to do that. Doesn't make any sense. Birth control pills, I don't recommend. I don't think they're good. And we don't do batching. We keep you moving. We're always online, always moving in the whole process, by the way. Let's see. So again, throw it out. I always give my number, 315-416-9872, Dr. Kiltz at cnyfertility.com. We have an amazing team. Buffalo, Syracuse, Rochester, Albany, Montreal, Atlanta, Colorado's coming. Dr. Magarelli, excited. Really from all over the country. We're working with your OBGYNs, with your fertility docs. with your family practice docs, radiology, LabCorp, but we're able to take care of people from everywhere and anywhere on this journey. Again, MK Terry, give a shout out and let the team know we're working on getting people in. I'm working on fasttrackivf.com along with our CMI fertile financing, how to get you moving faster. But remember, we don't want to rush. As you can tell, I have a lot of energy. Hyperactive attention deficit is how I grew up, but I'm really focused. I spend my days learning about how this human Ferrari, the miracle machine, works. And if you haven't checked out my TEDx talk, go to the Human Ferrari, Dr. Kiltz TEDx talk. It's amazing. Our job is to imagine how valuable each of us are. And yes, we have grown up with a lot of negativity and what's wrong with us and wrong with others, but we have to now change it up by changing the thinking. Remember, you in the mirror, that's where God lies. And when we can say, I love you, and remember when things come at us sometimes that seem a little hurtful, we do react, our buttons are pushed and we're like, oh my God, boy, I reacted to that. What can I do better today as every day? And we can live and learn from the masters of the universe. If you haven't read Jordan Peterson and checked out Michaela Peterson, who's a new carnivore convert, I've been doing near carnivore for 10 years nearly. I might spread it out a little bit. You know what? I was on my bike last week and I hurt my hip, so I got to slow it down because repetitive motion is not good for us, by the way. All right, Samantha Simpson, PCOS, male factor, female factor, infertility. We are praying to do IVF this summer. What will increase our chances? IVF working the first time. Been trying to conceive 8.5 years, able to have a regular period, progesterone, so that we'll need medicine with progesterone. So what will we need? Okay, look at my family building guide. But number one is, Kiltz's keto is a kick-ass amazing. Talk to your doctor about endometriosis and maybe think about a laparoscopy, hysteroscopy. You got to change the diet. I call it the baby diet because it makes babies all day long. So many people, hey, Dr. Kiltz, I did your diet and I'm pregnant. And when you're pregnant, you stay on it. And intermittent feasting, 1 meal a day at night, rest and digest, it's a home run. It's the most amazing thing you'll ever learn, by the way. So we're going to shift it up in the process. But check out, again, Fireside Chat, the magazines, drkiltz.com, low-dose naltrexone, don't forget the CBD oil, but everything I learned, it's about what you put in here and put in here. It's always male factor, it's always female factor, and PCOS is pre-diabetes. It's a high plant-based diet, healthy for us, no way. I'm telling you, plants are the prime predator of the universe and they're working to kill us all. They've master manipulated us in more ways than you ever imagined, by the way. So again, we'll get you moving forward pretty quickly. Sharon, Jesse, metformin got bumped up to 750 twice a day. Should I stick with that dosage? Maybe switch to. I like the myo-inositol and the keto kick-ass diet. I'm not a big fan of metformin. I'd say 500 milligrams once a day. If anything, inositol and intermittent fasting, which is intermittent feasting, it's 1 meal a day at night. If you gotta have a little snack in the afternoon, and remember, if you're a vegan or vegetarian, narrow the diet, cook it well, simplify it, and add either coconut fat or ghee, butter, cream, if you're a vegetarian. And listen, I am here to honor everyone, no matter their beliefs, their food. This process is the most amazing that you'll ever imagine in your life, by the way. Let's see, hold on 1 second. I'm learning every day how we can do better, by the way. And for whatever reason, my Instagram's not working as well tonight, but thank you for joining us on Facebook and share it with your friends and family. Tell them to check out the new Keto magazine And it really helps diabetes, hypertension, so many other things cleared up. I've had arthritis, migraines, colitis, hemorrhoids, bleeding bad, psoriasis gone because I simply changed my diet and I stopped exercising. And I'm telling you, I'll be 64 March 12th, by the way. And I'm amazed every day how well I feel at this young age. So, Jesse, I'm not a big fan of metformin and really trying to get us all to begin thinking in the same way, sharing the same ideas, and helping you get to that. And Happy New Year, Kimberly, for 2020 to everyone, to your family, your friends, your loved ones, your colleagues, to all of us on this fertility journey and trying to make this human miracle machine the very best. If you're looking for a cause of your problems, it's what you put in here, and it's most likely the healthy plant-based diet that is deadly in my opinion, but it's mostly a low-fat, high-carb diet. That's the problem. And remember, plants want to kill us. Is keto the way to go with stage 4 endo? Alicia, good question. Absolutely. Keto is amazing for everything. But remember, the term keto is a bad term anyway. You want to be a healthy miracle machine. You want to eat in a healthy way. One meal a day, add the fat, cook the carbs if you're going to eat them, simplify them. But if you're not better, get rid of them and go to a fish diet, a chicken diet, a beef diet. But in my opinion, bacon, eggs, butter, beef is the home run, the most amazing thing, because I believe endometriosis is a disease of the bowels. Inflammation in the bowels from a high fruit, fiber, vegetable diet is deadly. Probiotics are deadly, and they are the reason for diseases, by the way. And don't believe me, but do it. When you do it, you're just amazed how it works. And you'll go like, whoa, why didn't anyone teach me this a long time ago? And I can tell you from someone who had bowel problems and hernias and all sorts of things, they got better. All right, good question, Alicia. Hey, Laura. Lauren Donato, how you doing? Let's see. Keep reading that we are not doing Cleocin anymore for transfers. All right. I'm working away from the Cleocin because I think the antibiotic Doxy or Z-Pak is good. I think too much in the vagina probably is not good. If anything, an oral antibiotic or even the Cleocin vaginal cream, which is a lot less expensive. So if you've done it and it's worked, okay, but I'm working away from too much in the vagina, too much irritation. We got to slow it down. This is why I think a natural letrozole trigger shot with either checking the progesterone, adding the prometrium oral or vaginal, but keep it light and low. But the oral systemic antibiotics early in the cycle or with the post progesterone for 3 days may be all you need. But the Cleocin vaginal was too expensive and I wanted to really reduce the cost, and I think it wasn't helping in the process. So we're always moving it a little bit in the process, trying to really cut some of the costs and do the things that we find are valuable. Emily, PRP and intralipids on Tuesday and my third transfer Wednesday, hoping lucky number 3, and hold the faith. Remember, visualize, I'm having a baby, I'm having success, I'm not giving up in this process, by the way. Alyssa Rose, fatty liver disease causes infertility. All right. Fatty liver disease is caused by high protein, high carb diet, low fat diet. It is another indication of metabolic syndrome, pre-diabetes, high inflammation. Absolutely. If you have fatty liver, it's just another indication of inflammation. And most people can't figure it out. And I'm really proud of Maria for coming out with the carnivore diet book, because I've been talking about carnivore for a long time. And if you haven't checked out Carnivore Con 2019, I'm hoping to talk on it talk at the conference next year about Kiltz's keto and the baby diet and how keto helps your fertility. Remember, plants want to disrupt herbivores' reproduction and everything else in our lives. And we're just eating like an herbivore, Yet, yes, okay, we're an omnivore. You can eat about anything. And this high plant-based diet and being a vegan vegetarians, maybe for some people, if they eat it properly, or maybe their genetic predisposition is just a little bit better. Angelina, my grandmother, Nana, lived to 104, smoked Pall Malls, drank Manhattans, and voila, 104. Now, we don't recommend Pall Malls, tobacco, or alcohol. And by the way, alcohol is not good for us in any amount, but daily, forget it. Rarely from time to time, a little bit, by the way, but you got to keep it way down, by the way. Let's see, fatty liver disease. Again, fatty liver disease is a carbohydrate plant-based disease. It's not a fatty disease of eating. No one eats fats. And remember, plant fats or industrial fats are deadly for all of us, by the way. Brianna, consult in February, almost 3 years. Don't give up. We're gonna get you there. Hold on to the hope and the faith and the belief and the visioning that you're having a baby. I'm having success. And if you're holding on to the trauma and the pain today, it's going to hurt you today. You have to let it go. And if you haven't read Eckhart Tolle's The Power of Now, and we hold the power of all amazing things in life, you and I, right? And if you haven't checked out my Mind, Body, Smile, but we're going to get you there. It doesn't matter. I've seen 44 to 46 simply change their diet and get pregnant naturally. Amazing. Modern medicine is a focus on a high plants and pills and procedures. And if you simply shift it up, you'll be amazed how your body will begin to function like the amazing Ferrari, Miracle Machine, Lamborghini, whatever you want to call yourself. But know this, no matter the size, the shape, the age, the troubles, the challenges, change your thinking about who and what you are or were or gonna be. Give yourself the accolades and the love. We all deserve the love every day, by the way. All right, let's see. Meg Leanne, how you doing? Thanks for joining us, by the way. Do you still want your patients to do the vitamins? Theralogics, we do a lot of the Ovavite for women, Conception XR for gals, for guys. The LDN for everyone, Lotus naltrexone, 3 to 4.5 milligrams, keto, and Kiltz is keto, baby. Remember, paleo, keto, intermittent fasting, I call it intermittent feasting, 1 meal a day at night, and it's amazing. You want to rest after eating to digest, and light exercise, light resistance, but keep cooling the body, cool the testicles, cool the eggs. Remember, a high plant-based diet ferments in the colon. That's causing heat to the ovaries and the testicles. That is not good for any of us, by the way. Monica Menzies, how are you doing? Pleasure. Let's see. Hey, Trish. Dana, how you doing? Nikki, Christine. And we're working by adding more team members, moving forward with our fast track IVF, our preserve with egg, sperm, and embryo freezing, ovarian and testicular tissue freezing. We're really working more and more and more. And working to get your sperm shipped to us, frozen. We can help on the travels, and there are nonstop flights from Denver. I didn't know it. And it's really for people looking to save money in IVF. CMI Fertility is the leader, has been the leader for 20 years, and will continue to lead on the process of affordability, quality access, and integrating Eastern and Western medicine. We're not going to give up on this, right? And I've seen so many just simply let go and have faith and believe and change their ingestion. Remember, put in positive thoughts, put in the positive foods that we talk about. It really, really, really matters, by the way. And Camilla, thank you for your thank yous and my gratitude to everyone out there that we'll just continue on this journey. And there are times we don't get eggs or embryos. We are working to continue to help people in the 3 cycles at 39, the 4th at 950. If you don't get eggs or embryos, working to get you a discounted cycle for another one at one time, and a donor egg add-on at a very affordable price. Bring your own donors, donor egg and donor sperm, to help save you more. We're going to really work on some new ways, and we're really grateful to everyone. Remember, we don't turn anyone away because of size or shape or AMH or failed cycles. We do both fresh and frozen cycles, day 3, day 5, 6, and 7s. We do honor to do PGS, not do PGS. And remember, the embryos that are biopsied may be incorrect. And so you got to be careful. If you think they're absolutely correct, I don't think so. But again, we're really willing to work with everyone on the journey, by the way. I recommend keto, Kiltz's keto, for everyone. It's the baby diet. And if you haven't looked at my family building guide and checked out the ice cream recipe, now remember, not every night, maybe 1 or 2 times a night. You have to, life is meant to be enjoyed. But remember, if you're putting things in your body that are damaging and harmful in any manner, that's not good. You know that, right? Yes, they're Logic Vitamins. Hi, Alicia Deal. How you doing? Let's see. Jessica V. HSG showed arcuate uterus shape. It doesn't, the arcuate uterus doesn't have a significant impact. A big septum does, fibroids, polyps, those can. Bicornate, unicornate, somewhat, but we still get some success out of that. Saline infusion, doesn't believe it's necessary, is SIS. So the saline, the hysteroscopy or an SIS can be helpful. I think that we do a lot of hysteroscopies, especially at the time of retrieval, can be helpful. Find some small fibroids or polyps. We often can remove those. But again, and don't forget, talk to your OB/GYN about laparoscopy, hysteroscopy to look for endo or other causes. All right. Enjoying twins kicking back 19 weeks. All right. Baby 4 and 5. All right. Lolly, awesome. Thank you for joining us, everyone. I feel just so blessed to be able to share our journey with you, your journey with us, and we are all learning every single day. Do we make mistakes? Absolutely. I've got a bunch of humans working with us, right? And humans make mistakes because sometimes we're looking for our keys, and where are they? No, I often look for my glasses and I'm wearing them, and it's like, okay, that's weird. And I know it's crazy, right? Jessica, Nelly, hello, and Pepper Zeitz, how you doing? Tiffany, more follicles. All right, reduce inflammation. This is where priming, Somaderm, human growth, LDN. We're working more and more and talking about a little bit of estrogen, a little bit of topical testosterone for a 2 to 4 week priming can be helpful. I personally think letrozole and the Orlissa or Lupron, again, reduce inflammation, endometriosis, and don't forget Kiltz's keto, absolutely helpful. I've seen ovarian function, sperm function come back. Very, 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 very powerful. What we put in our minds and our mouths matters most, right? All right. Any chance of viable pregnancy with a 19-HCG? It could be. Don't stop your meds. Stay on them. Let's get you moving forward for sure. Clomid or letrozole if you're already ovulate on your own. Yes, either one. We do a lot of letrozole. Better tolerated, I think, for a lot of people, and a little less side effects. I usually do 5 to 10 of letrozole, 3 through 7. Trigger shot day 11, 12, or 13. But some people do better on Clomid. Looking more at a little bit of Clomid, a little bit of letrozole, a little bit of injectables for a few days to help build the egg environment and the uterine environment at the same time. Oh, don't forget, journaling. Write your feelings, your stories, but most of all, you want to write down the positive beliefs that you want to be seeing in your life. That's it. Think it, ink it, and it shall be. All right, Natalie, how much more likely are you fall pregnant naturally after excision surgery for endometriosis? Excision, vaporization, letrozole, Lupron, or Alyssa, all of those things are going to bump your chances 10 to 20% over the next 3 months. And I'm kind of giving you a random number, but I think those are pretty close to the benefits. As long as your fallopian tubes are open, the sperm is reasonably normal-ish. But remember, guys, yes, don't forget HCG injections, Clomid, Conception XR, LDN, CBD oil, and cool down. Get off the gerbil wheel of exercise. Too much, too hot, too damaging to your sperm. That'll help pregnancy occur, by the way. And sex every day is good. This idea that you should take some time off and have sex only every 2 days, there's really no good evidence to that. All right. Shema saying, Kike, how you doing? Hi. All right, let's see here. After miscarriage, December 3rd, how long should I wait to try another donor egg? Looking like about 2 to 6 weeks is a good one. Get in for baseline ultrasound and blood work. Take a look, make sure your thyroid's good. Try to get an evaluation. Okay, what do we do next? Do we change anything in the process? Don't forget, keto is kick ass, and Kiltz is keto, amazing. I am primarily carnivore, bacon, eggs, butter, beef, and ice cream. Keep it simple. If you don't do pork, remember this. There's beef bacon. It's amazing. Add fat, add cream, add butter. It's the fat, intralipids, Lovenox, Plaquenil, prednisone, IVIG, Humira, LIT. Look at our list. I'm going to make sure that Will gets it on our website. Download Dr. Kiltz's list and letter, or letter and list. Might be a good one. Make it easy, and I'm going to try to get it inside of our family building guide so it's there for everyone. Hey, David V., how soon can you do an abdominal ultrasound if you don't want to do a transvaginal? 6 to 8 weeks, I think, is good. We'd like to get it early, but you have to have a full bladder, and it can work. And even if you did it at 5 or 6 weeks, an abdominal ultrasound, again, we're going to start looking and talking more about that. Limit the vaginal scan, a quick look inside. That should be minimized. Do you have, and we're really looking to make sure you don't have an ectopic, but at the same time, we want to make sure that we don't want to be harming the process. I think we do too much intervention in modern medicine. We all need to step back a little bit. JN88, pleasure. A hug and a kiss to your lovely little one, daughter. And again, once you're pregnant or have a baby, you got to keep on this Kiltz's keto concepts. It really is all the things we're talking about. You want to go out and enjoy life, painting, poetry, pottery, making music, slow it down, a little bit of light riding and resistance exercise. All right. Shema, I did IUI in 9 days post I would have a faint pregnancy test. I'm still with progesterone, but it looks like period is coming with the pink spotting. Stay on your meds, get your test. It's possible. It's a hard one to know. There's sometimes some spotting early on, even in a normal pregnancy. So don't give up on that, by the way. Mini IVF. Hey, Vicky, we do a lot of natural and mini IVF, lower dose meds, fewer eggs and embryos, fresh transfer. I think it could be a home run in all of this, by the way. And so again, let's not give up on the journey by the way. But mini IVF, I think, really can be very helpful. We're really working on, hey, I do a natural cycle, a single trigger shot, one retrieved egg, fertilize it, transfer it day 2, 3 in the post-retrieval, minimal meds. We're going to really work on that. I may look at something to cut the cost in some way to help you in the process and help more people do that. Remember, you don't have to fertilize all the eggs. You could freeze some eggs, only add sperm to 1, 2, or 3 eggs. That's another way to do it, by the way. Hey, Denise. After 2 rounds of IVF and 2 failed transfers, what additional testing would you advise to do before moving to another cycle round? Don't forget laparoscopy, hysteroscopy. Look at your immune profile, immune treatment. Look at, are you doing keto? Do you need to do a 1 to 2 months of Orilissa, letrozole, antibiotics, antifungal, antiviral? Don't forget the silent infection, silent endo. We got to look at that much more in the process. Nicole, Nahid, how you doing? Any surrogacy help in 2020? LA Surrogacy, we're working with Melissa Brisman and some others. We do surrogacy. If you know of someone that wants to be a lay surrogate, wants to do it as an inexpensive way, for a lot of people, we're here to help. And absolutely, but look at LA Surrogacy. We're working with them, making the process more affordable, more accessible in the process. If you have your own surrogate, bring them on board. We'll help you with that. Intralipids and IVIG. What is the alternative for LIT? So the antihistamine protocol may be something to think about. Intralipids, fat, don't forget keto, and IVIG are all things to help with reducing inflammation, enhancing implantation for those with repetitive miscarriage, repetitive failures, or just infertility. Because again, the cause of infertility is inflammation. Leukocyte immune transfusion, Markham Fertility in Markham with Mike Vero in Toronto, awesome team, really can be helpful, by the way. Hey Nikki, how you doing? Medicaid monitoring cycle. We're gonna get you going. And it's, you know what? I had a great 2019, really learned a lot. We've grown tremendously, but we want to make sure through our growth, we're able to take care of everyone. The new and different ideas. Again, looking to bring on Colorado with Dr. Magarelli, excited about that. Between all over Colorado. My daughter Pilar, born in Denver, did my residency, University of Colorado Health Science Center, 87 to 90, really fond memories. And so a lot of people coming from Colorado. I still have my Colorado license, so I have a lot of fond memories of that, by the way. Let's see, Mullicat, please, what is the contribution of adenomyosis? Again, adenomyosis, endometriosis, inflammation. That's really it. I whittled down and tried to go one by one in those in the questions. Let's see. Buffalo, I'm looking in March, April. We're working with the city there, getting our permits. We had just got our generator, our gases are coming in. Dr. Chang is there. We got our team in place, so it's coming. They're not going to be able to handle what we do in Syracuse, so we're going to still be bypassing Buffalo a little bit until they get up to snuff there. We're going to be doing an addition coming there. We're really excited about that, by the way. Atlanta office is, we're working 2020, 2021 for IVF there. I may be starting with just doing some frozen embryo transfers down there, getting Dr. V and our team properly trained. It's really just to make this whole process easier, more affordable, for sure. Bacon, eggs, butter, beef, and ice cream, the baby diet. Kiltz's keto is amazing. I'm primarily carnivore, but I did make some really awesome French fries dipped in mayonnaise, fried in duck grease. Amazing, by the way. All right. Elizabeth G. What is your take on unicorn uterus, reproductive outcome, non-communicating horn? If you have an active non-communicating horn, it might need to be removed. But I've seen unicorn uteruses deliver babies. Some of them might be more early deliveries. There might be a consideration of a cerclage. But if it's not working with your uterus, that's where we look towards a gestational carrier. But we've seen so many unicorn uteruses have success, IUI, IVF, even natural, and the consideration is to remove that non-communicating horn. All right, and a shout out to Danielle and my Preserve team, Nadia and Kim, and Patrick, Mooney Marketing, for really helping me share Kiltz's Keto, drkiltz.com, Mind, Body, Smile. I'm really looking to continue in sharing coffee with Kiltz on a regular basis. You know, I'm weaving in and out. I've got our Fertile Fireside Chat, really excited about it. The kids, and share your pictures of your successes. Share your stories on our websites. Share us how keto, paleo, or what you're doing helped in the process. I'm really, really excited for you guys all to share, by the way. Mini IVF, if we come from Texas, can we get everything done in one trip? Absolutely. People from Texas, Utah, Louisiana, Mississippi, Alabama, Georgia, Florida, California too, by the way. I'm the California LA kid from Silver Lake, but mini IVF, we're letrozole 10, 150 of injectables. It might be just sequential. We're just getting a few eggs. You're getting 2 or 3 embryos. You're transferring 1 or 2, putting some on ice. We do a lot of fresh day 3s. We've seen a lot of success in it, by the way. All right, we're finishing up here in a couple of minutes. Thank you. We got to recruit our Instagrammer, but again, maybe it's all because Facebook is the guiding light to this. But really grateful. We're going to be really sharing more and more of your stories this year. Please, some Facebook Lives, some Instagram Lives, some YouTube Lives, but mostly share your stories. Share and critique how we can do better. We humans, boy, we are very imperfect in this journey, are we not? What about DORs? It's still worth it. Even with DOR, we're doing some natural cycles, single trigger, 1 egg, 1 embryo, and a transfer. Don't forget DHEA, CoQ10, folic acid, fish oil, vitamin D. This is where the Conception XR for the guys, and the Ovavite, low-dose naltrexone, and a high-fat, low-carb diet, no-carb diet. I'm telling you, it's a home run, amazing. I can't believe it. Hey, Mommy to my 4, how you doing? Let's see. Emily Davis, advice on frozen embryo transfer. One frozen transfer in November ended with a miscarriage. January 19, what would your advice be going into a frozen transfer? It would be placed on progesterone suppositories as well as the injection. Consider a letrozole trigger shot, simplified a lot of what we're doing. Intralipids, Lovenox, Plaquenil, Prednisone, Neupogen, some of the immune protocol, or a simple. Don't forget, light therapy, acupuncture, massage, meditation, prayer, visualization, and remember, don't give up. Keep going in 2020. I'm hoping to see so many more successes, and we have to help everyone together. Listen and learn and support. That's it. I got my little L, which is listen, learn, and love. All of us need to be doing that to the mirror. Remember, the God in all of us, and we are all feeling the challenges of life, are we not, right? It's a crazy one. Let's see, Danette, Syracuse officer. I'll be in Syracuse tomorrow, Danette. Look forward to seeing you. Kim Ramsey, let's see, what's your take on Whole 30? Listen, Whole 30, look at Kiltz's Keto, look at Emmerich's stuff. You should be doing it for life, by the way. 30 days, I don't think it's enough. But if it's a high fat, low carb, no carb, I think it's okay. But you know, these 30-day gimmicks, it should be a life plan. What you do to take care of your body to get pregnant should be obvious always and forever. That's my story on it, by the way. But again, if it gives you something that you're willing to get started on, I think it's a good way to go, by the way. Don't give up on it. All right, it's 9:01. Thank you to everyone, by the way. Chelsea, Emily, Susie, Lynn, and the 5.8 AMH is good. Hannah, if you're not getting your period, call the office, get an ultrasound and blood work. Lena, how are you doing? Can you list surrogacy on your website, please? We want to look into that. Lena, listen, we're going to get surrogacy written up and added to that. We want people to know CY Fertility does surrogacy for sure. So I'll give a shout out to Patrick to get the team and the LA Surrogacy group to get stuff on there in our magazine and on our website. All right. Again, Natalie, blessings. Again, to all, thank you. See you guys next week or see you this week, maybe with Mind, Body, Smile or Coffee with Kiltz. God bless to you guys. Thanks for joining.